Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of Muscle Care. I see 55,000 patient visits a year in my practice. We understand pain. If you or anyone you know has been in a car accident or 2 car accidents, even from a long time ago, and they're still suffering, give them this mini series of stretching. It will help them to start to move and change that protective muscle contraction. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that we're warm, and it's incredibly important to be warm after a car accident so that we can stretch more effectively, let's get that relief happening. For an effective side of neck stretch, let's keep the feet shoulder width apart. The pelvis is square to the ground and your hips are right under your shoulders. Your ears are over top of your shoulders. And all you're gonna do is keep your nose straight ahead and tilt your right ear to your right shoulder. Do not let your nose point down. The nose stays straight ahead. You're trying to get 45 degrees. And remember your Super 6 rules. You're gonna do the other side the same way. For the back of neck stretch, stand, feet shoulder width apart, pelvis square, slight pelvic tilt if you'd like, shoulders over the hips, ears over the shoulders. And now, in order to get the back neck muscles, what you'll do is simply rotate your face to the right, keeping the jaw parallel to the ground. And again, go to comfort. If there's any sharp end feel, back it off a little bit. If you feel dizzy, back it off and do less. Go into your side stretch, ear to shoulder. Do not let the nose tilt down. Keep it straight ahead. And then rotate the nose up to the left. You'll stretch the front of the left side of the neck. If you want more, hold your arms behind you for more stretch of the connective tissue of the front of the neck and the anterior chest wall or the front of chest. Do the same on the other side. For the front of chest stretch, your right arm should be perpendicular, parallel to the ground, and you would actually try to hook your hand onto a wall for support. And if you can extend your fingers backward in order to open up the fascia and connective tissue of the forearm and the hand, you'll get a much better stretch all the way up the arm, all the way through the chest. But remember, what you want to do is feet are planted square on the ground, and you rotate your body away from the side you're stretching. That includes your neck. So if your right hand's on the wall, you'll turn your face and your torso to the left. Okay, do the same thing on the other side for balance. For the rotator cuff and the posterior or the back of shoulder, again, right arm across the body, keep the right arm parallel to the ground. Grab the elbow with your left hand, pull it close to your body. Feel that stretch in the back of the shoulder already. And then turn the torso, the face, the neck, everything as far as you can in the direction your fingers are pointing or to the left. Do the same on the other side. What we're going to do now is a torso stretch. Hips should be right under the shoulders, ears should be right over top of shoulders, and you'll do a torso stretch. You can hold your hips and just twist the spine and the neck all the way up to the top in rotation to the left. Do not move your hips. As you've done this stretch and you've held it for 30, then for more stretch, you can turn your pelvis further to the one side. Do both stretches equally on both sides. For the side of spine, make sure that you actually open up your legs. They're wider than shoulder width for stability. Put your left hand on the left side of your lateral left leg or hip. The right arm goes straight up in the air and you lean to the left side. So your right arm should be pointing to the left and it should be straight all of the time. Do both sides exactly the same. Now, for the front of leg or quadricep, we call it stretch, what you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight, you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. Let's sit neutral or stand neutrally, ears over shoulder, let's not slouch, and let's gently open the mouth as wide as we can without pain. And hold that for 30 seconds to reduce masseter and temporalis tension in the side of the face. What happens when we look down at our phones all day, we actually retract and pull our jaw backwards. We create a lot of tension behind the jaw, around the ears, again, blocking blood flow, blocking lymph. So what we want to do is we want to sit tall or stand tall, ears over shoulder, and open your mouth, and slowly but surely protrude the lower jaw out, again, to the point of comfort and a nice gentle stretch for 30 seconds, and then relax. This may take a few reps. For the wrist extensor and flexor stretch, hold the arm straight. Make sure the elbow is locked. Push the wrist down and use the other hand to pull the forehand toward the body. Keep the fingers straight. Maximize the stretch through the entire extensor surface. Hold that until the burn goes away or that stretch goes away. Then, to stretch the flexors, just simply keep the arm straight, pull the fingers up, push the palm as if it's going forward, and pull those fingers back toward your shoulder. Hold that for 30 seconds, or at least until the burning in the bottom of the flexor muscles go away. If you're doing back extension, back flexion while you're on your hands and on your knees, that's called a tabletop. Start in a tabletop where the spine and the neck are perfectly straight. Then, simply letting the tummy drop forward to the ground, arc the back, look up. Let's open up the front of those neck muscles that are tight from looking down at our phones all day. Let's get that extension in the back. So arcing is fantastic. Hold that for 30 seconds. Once you've done that, reverse. Go into a C curve, looking downwards. Again, don't make it hurt. Just gentle stretch. And I'd advise staying in that position for flexion shorter, 15 seconds, and then go back into extension, because that's where you're going to get the most amount of benefit in today's society that we live in. For the standing shin stretch, if you've got knee problems and you can't kneel, this is a great stretch. Stand holding a wall, have a chair, have a couch behind you. Keep the one leg, the balanced leg, perfectly straight. Stand up nice and tall. Bend your other knee to 90 degrees. Open the ankle up and get those toes of yours, the top of your foot, on a couch or a chair. That's going to open up the front of ankle. And then what you can do is you bend the supporting leg a little bit if you want to lower yourself down and put more torque, more stretch on those front of shin muscles. That's a great stretch to prepare for walking, running, and any sport going. One of the best hip and spinal stretches you can do is when you sit on the ground, legs out in front, bend the left leg up so that you can lift your left foot over the right knee. Rest the foot flat on the ground, and then keep your body at 90 degrees to your legs. So what you're gonna do is you're gonna turn your upper body to the left and hook your right back of elbow on the outside of the left knee. Make sure that your face, neck, upper back are all twisted to the left, and use that right elbow on the outside of the left leg for leverage. Deep breathing. Make sure you can breathe, because if you can't breathe, you're stretching too much. That is a fantastic stretch, but you're stretching a lot of large tissue, especially in the hips and the gluteus area. So holding that a little longer may be needed. The hamstring stretch using the chair or using support is great for those people that have balance issues. In fact, if there's a little balance issue, this is the one to do. If you've got lots of balance issues, let's stretch the hamstrings seated on the floor. But in this case, let's keep our legs virtually shoulder width apart, almost perfectly straight. Slight bend if you have to. Bend or hinge at the waist. Use the chair for support. And again, just get closer and closer to that chair as you can. The full body stretch. Let's stand, feet shoulder width apart, pelvis square, shoulders over pelvis, ears over shoulder, arms up in the air, straight up in the air to the sides of our ears. They don't lean forward, they don't lean back, and they reach up. We hold that, we deep breathe, and then if we really want more stretch, we go up on our tippy toes and try to reach the sky. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? Muscle Care is the new subtopical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're going to love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.